I am almost certain that you've heard of broken heart syndrome, but what is it exactly? Well, on this Valentine's Day, a cardiologist is here to explain the heart condition that's often brought on by extreme emotion. And joining me right now to talk about it is Dr. Thomas Schlueter with Ascension St. Vincent, because a lot of people think that broken heart syndrome is just a myth or something that we talk about when our heart's really hurting, or maybe we're feeling, something after a loved one is maybe passed or we've gotten broken up with. Is it a real thing?
It is a real thing. Good morning. Thanks
for having me.
Yeah,
absolutely.
But it is a real thing. It's a syndrome that's poorly understood that mimics a heart attack. The signs and symptoms are identical. Chest pain, trouble breathing, feeling very poorly, feeling run down and tired, almost passing out can be a symptom as well. The blood work, the tests we do mimic a heart attack as well. And so we frequently test people for having a heart attack and find out they're not having a heart attack.
Okay, so what is the difference? How do you then, if it mimics it, what is that key? They have to come to the hospital to know if it is or not?
Well, they're feeling poorly, so they usually do come to the hospital, right? They're feeling bad. They come to the hospital. We do the tests that tell us whether they're having a heart attack. So we look for blocked arteries, which is what a heart attack is. And we find no blocked arteries. And we find other parts of their heart aren't squeezing the right way. They're not working in a very typical way with this syndrome.
Do you see that? Do you actually see it very often in Indiana?
We have a huge practice in Indiana, so a practice as big as ours at Ascension, we see a couple cases a week.
Yeah, it sounds like something to me that I know a lot of people that suffer from, panic disorder, having anxiety, and they feel like they're having a heart attack sometimes too. Is it kind of similar to that feeling sometimes, or is it really different in how it feels?
It's different, that feeling. Now, that feeling you just mentioned is a very important thing that should be checked out as well. It's also important to remember that this doesn't have to be triggered by an emotional stress. Sometimes it is, but sometimes it isn't. But you're right, that if someone is feeling those symptoms, whether they think it's a panic attack or not sure, that's why our hospitals are open 24 hours a day, so we can help them get through that.
We hear this a lot of times when it is, feels like anyway, an older couple where someone who's been married for a long time, and then one dies, and then a few days later and they're like, oh, it was broken heart syndrome. Do you see that in those cases where, or is that maybe accurate?
It certainly can be related to this, and that's harder to know because I don't know that we always know that, but we certainly see that's a very common thing of someone spending their lives together and passing within a short period of time from one another.
Who's more susceptible, men or women?
Women are more susceptible.
Do we know why?
We don't. And we're trying to figure out why, but it's certainly more prevalent and slightly more prevalent in women than men.
Okay, so how is it treated?
It's a great question. So we diagnose this to make sure you're not having a heart attack, and then we do whatever we need to do to support you. We usually put you on medications to make sure your heart stays strong or becomes stronger, and usually within 4 to 6 weeks, everybody's recovered and back to normal.
It really is an interesting phenomenon. Is there anything else that I wouldn't know to ask you that our viewers that are watching right now
I think
ask the doctor this.
Yeah, I think it's a great question, and I think one of those things are, how do you know? How do you know? How do you know this is a panic attack, or how do you know this is it? That's why we always want to be careful. If you're having chest pain, if you're feeling poorly, if you're having trouble breathing, seek medical attention. And that's why the biggest thing is have a relationship with a healthcare professional. So when there's a change, you have someone you can call right away and let them know.
Well, anytime I meet a cardiologist or a doctor that does what you do, I always say thank you, because my father had the Widowmaker.
Oh no.
And he was helped. He lived. So I always say thank you, thank you, thank you. What you do is amazing.
We're blessed to be in such a great field. So much advancement has come around in cardiology, and you ain't seen nothing yet. We have a lot of things coming forward.
Okay, excellent. We love to hear that. So if you do have heart concerns, you can schedule an appointment with Dr. Schlueter or another cardiologist at Ascension. I want to go see him. We'll connect you at fox59.com/links. I'll make you feel better and make you know what's going on with your heart.
Fantastic.
Good to see you. Jim.